Somebody will say, oh no, this is what some patients whose skin is almost healing from burn injuries cry out when they see that their mixed thickness burn injury is looking like this. Oh dear. So just what is happening to this man's skin? Why does it look like a leopard or cheetah skin now? Is there any hope in this skin coming back to the normal brown skin, the normal surrounding skin that this man had before his mixed thickness burn injury? My medical fans, when a burn injury happens, the pigment, that is the color from the skin, is lost. Can you see it? But as it is healing, this color, it might come back. But this process of this color coming back, it is unpredictable. Often, newly healed skin appears pinkish. It can appear even whitish pink. Can you see? But as the scar is maturing, the skin that has undergone this burn injury, it may regain its color, it may regain its pigment, like this, the surrounding skin. But my medical fans, did you know that the color of our skin is determined by the amount of melanin? Melanin is like brown pigment too. It's brown pigment. The color of our skin is determined by the amount of melanin or brown pigment in the top layer of our skin. But when our skin is burned, this pigment, this melanin, it is destroyed temporarily. But your new skin, somehow now, as it is coming out, will somehow be looking pinkish, sometimes reddish, sometimes purplish. As you can see in this black man, like you and I. But my medical fans, over the next few months, can you believe that this melanin pigment, it will be slowly returning and beginning to look similar to your surrounding skin? See them now. Can you see those dot on this man's leg? Can you see the dot? Yes, those dots is the melanin pigment, which is slowly returning and beginning to look similar to the normal skin that is surrounding that burned area. But my medical fans, this can be a long and slow process that can take up to 2 years even sometimes. Some of this pigment, this dot black, brown that is coming back, it can sometimes not return, and then the skin will now stay a bit lighter. But some areas can even become darker over time as the melanin is coming back. It might even be darker than even his surrounding skin. Like you can see all these dots. That's the melanin that's coming back. But over time, it can either be lighter or even darker than his own normal skin that you are seeing here over time. So, my medical fans, you can have hypopigmentation, which is lighter than his normal skin, or hyperpigmentation, that's darker than his normal skin. But it may improve over time. Sometimes if it's darker, you may need some treatments to help lighten the skin. But if it is lighter than your normal skin, then it may improve over time. But sometimes it might just remain that lighter skin color. All right? And see, my medical fans, the skin, your skin, it may change color as the temperature of your environment is changing. Because the blood that is flowing through this scar tissue that is forming on this man's skin, it is, flowing through. As it's going through, it may become redder as blood is flowing through. So if it is hot, you can see that the scar will be looking maybe more redder than usual. But as this scar is maturing over time, as time goes on, this color will improve over time. So just remember that if you have been burnt, this your new scar tissue is a different color to the rest of your skin, okay? And it is because of this layer containing this your skin's natural pigment, melanin, taking longer to recover. So don't forget, it may take many months for the pigment to change, and in some cases, even the skin pigment may not always return to the original color. Just take note too. And see, sometimes after this burn injury, you can have swelling of your arms, swelling of the area in which you had the burn injury, like this man. Don't be worried. You can raise the arm, you can position it up above the level of your heart, up. Even your legs, you can raise them up on pillows to help reduce that swelling, which is commonly, we call it edema. You can also do some exercises, and sometimes you can even use some things that we call pressure garments to help reduce this edema that you have on your legs, on your arms, your upper limbs and your legs. And do you know that some of us have had burn injuries, my medical fans? You can have sensitivity because this is this scar that is over your body following the burn injury. It can be very sensitive. Can be very, very sensitive following that burn injury. So sometimes you might have, if you do some regular massage, it helps to reduce the sensitivity, And you can also use, soft things on your body, like soft towels, soft cotton wool, to help ease that very, very sensitive skin that you feel it very sensitive. As soon as something touches you, you feel it very quickly. Okay? So using those soft materials can help your body return to normal function. Your skin will return back to normal function as soon as possible over time. How about itching? It is very, very common for this your newly healed burn wound to be very itchy. So please don't forget that you shouldn't scratch, because if you scratch, this skin, it is still very, very new. It can actually break. So instead of scratching, if you want to ease the itch, you can use like your moisturizers now. Like, you can even put this your moisturizing cream in the fridge. You can bath in cool water, not cold or not too hot, because that one can irritate your skin. And then wear soft cotton clothes. You wear soft cotton clothes and you sleep under cotton bed sheets, which are all soft and not irritating to the skin. Your skin will heal faster. As I said before, if you're using one pressure garment to help prevent scars, they call it pressure garment, you can apply it anywhere over the burn area to help reduce the formation of scars, especially in very, very deep burn wounds. If you have pressure garment too, that will also help you with the itching. So sometimes actually you might actually need some drugs to help with this your itching. So make sure that you tell your healthcare provider, who can now advise you or give you a prescription on what to use. Sometimes you just use some Panadol, some paracetamol, some ibuprofen to heal some pain over your burn area. You can also use some antihistamines like this chlorophenamine, Piriton, to help with this itching wounds. Okay? Sometimes you may need something stronger. So just take note that sometimes you might use, things like gabapentin, pregabalin, and amitriptyline for those very, very painful and itchy neuropathic scars. But always discuss it with your doctor, okay? And don't forget also, my medical fans, that this your scar tissue, it doesn't have the same protection against the sun as it did previously before you burnt it. So it can develop blisters if you enter into the sun. So remember that if you're going to enter into the sun, you have to use sun protection factor creams, at least 50. Apply it every time before you go outside, even during the cold weather or during winter season or during Harmattan season. And also use a hat to protect your face and neck if those areas too have been burnt. Okay, my medical fans. Remember that if you expose your skin to sunlight, your burnt skin to sunlight, which actually contains this UVA and UVB rays, it is harmful to your skin. And after the burn injury, just remember that your skin is more vulnerable to the harmful effects of the sun. Sun exposure can even cause the skin to even become darker than it is. Your scars. So take extra care while you're in the sun for at least 2 years while your scar is maturing over time. The color comes back fully over time. So thank God we're not white people. We are black people, so we don't sunbathe, at least, isn't it? We should just avoid directly exposing all these our burn areas to the sun. Always cover up with clothing. Don't expose your legs like this, your arms like this that have been burnt. Don't wear shorts. Always wear socks if you have one over your legs, or trousers. Cover the areas. Don't wear skimpy clothes. Cover up. And remember that most clothing is not sunproof. So use your sun protection factor. In fact, in some countries, they even have sun protection factor sun suits available for children. So always wear your sun hat, wear your cap if you have burns to your face, to your head, to your neck, and use that sun protection factor cream. At least 30 to 50. You can use it in the form of creams or lotions or even sprays. Wear it over your body before you go out into the sun. Also, if you keep on massaging your skin following that burn injury, the glands which produce the skin's natural oils can be damaged. So, your skin, of course, it can be dry. So just remember that once your wound has healed like this, remember to wash your scar with a mild soap, not an irritating soap, at least maybe 3 times a day, to prevent build-up of, the cream, which in turn can block your pores and cause spots. Okay? And remember that your cream should be plain. No, it shouldn't be perfumed because it can cause irritation to your skin. So just initially, just apply light pressure as your newly healed skin is fragile. So just apply it lightly because your newly healed skin is very fragile. And then you can increase the pressure when massaging so that the tissue underneath becomes, softer and paler over time as time goes on. So always do your scar massage across the scar in a circular motion for 5 to 10 minutes, depending on the size of your scar. If you have, it's important to use silicone gel over your wounds because it can help reduce the appearance of maybe existing scars, reducing the size, the stiffness, the redness, of scars forming over your wounds. Just remember to ask your doctor if you're not sure whether you should use it or not in case it has not been prescribed to you. So remember that your skin is going to be very sensitive after your burn injury. Remember to look after your new skin and your scars. Moisturize your scar daily for at least 1 year after the burn injury, please. Don't use those perfume moisturizers. Choose all those oil enriched moisturizers, all these cocoa butter, Vaseline, Aveeno, they're very good for the burnt skin because it will help lock in the moisture into your skin and it will keep your scar hydrated, supple, soft. For all those your itchy scars, try keeping your creams in the fridge, okay? So that when you're applying it to your skin, it's cool and, gives you that soothing effect. So as I said before, you massage your scar with deep pressure in a circular motion. Remember that there are many benefits for daily scar massaging, okay? So it prevents your abnormal scars from forming, so that by promoting that collagen in your skin by promoting the organization of the collagen in your skin and also preventing all that irritation and hypersensitivity because of touching of the skin. My medical fans, did you enjoy this live review of leopard skin following your burn injuries? Tell me in the comment section if you did, and I'll give you more episodes of these important medical conditions that you'll come across, or that you have, or that your relation has, and you can educate them. Let's keep on educating ourselves. Love you guys. Bye. Click like, of course. Click thumbs up and tell me in the comment section. Bye.